Comment your name and state below. I'd love to see who's watching and benefiting from these videos. And if you or someone you care about is trying to understand how Medicare prescription coverage really works, today's video might finally give you the clarity no one else seems willing to explain. Because for years, people have told me they feel more confused after reading official Medicare letters, plan brochures, and even watching other Medicare videos. So today, I want to break this down in the simplest, most human way possible. No fancy language, no complicated charts, no insurance talk. Just the plain truth about Medicare Part D, how it actually works in real life, and what is changing in 2026 that could save some people hundreds or even thousands of dollars a year. I want to start with a story, because sometimes a real person's experience explains things better than any brochure. A couple months ago, I sat with a woman named Linda from Ohio. She's 67, retired from working at a school cafeteria, and she takes 3 daily prescriptions, 2 generics and 1 brand name medication she absolutely must stay on. When she first got into Medicare, she chose a Part D plan based on the lowest premium, because like most people, she assumed the cheaper the plan, the better the deal. But every time she went to the pharmacy, her price changed. Some months it was $12, other months it was $48, and one month she went to pick up her brand name medication and it was $137, out of nowhere. She felt embarrassed arguing with the pharmacy tech, and she told me she started rationing her medication because she didn't know whether the high price that month was just a glitch or her new normal. This is the kind of confusion Part D causes for millions of seniors. And the truth is, most of the confusion doesn't come from people not understanding Medicare. It comes from Medicare being a program with moving parts, drug tiers, formularies, deductibles, co-pays, different pricing phases, and nobody ever explaining to people what all those things mean in their everyday life. The brochures explain the what but not the why. So today, I want to walk you inside the system in a real, practical way so you finally understand what's actually happening behind the counter at the pharmacy. Part D plans are built around a structure that every insurance company must follow, even though they all design their plans a little differently. And if you can understand that structure, everything else becomes so much simpler. Think of it like going through a grocery store. Before you can check out, you pass through different sections, each with its own set of rules. Medicare Part D works the same way. It has stages. And in 2026, the way these stages affect your wallet is going to be dramatically different than it was before. So let's talk about how things work today, right now, and then how they'll work in 2026. Because 2026 is the year a lot of seniors are finally going to feel some financial relief after years of rising drug costs. For the first time ever, Medicare is putting a hard limit, a real, enforceable cap, on what people can spend out of pocket for their prescription medications. But let's go step by step so everything connects. When you're in Medicare and you have a Part D prescription plan, every single one of your medications is placed into a tier. These tiers control your price. If you've ever wondered why a medication costs you $5 one month and $47 the next, or why one generic is cheap but another generic is weirdly expensive, the answer almost always comes down to drug tiers and which stage of your plan you're currently in. Tier 1 and Tier 2 drugs are usually the low-cost generics. These are the ones most people pay the least for. Tier 3 and Tier 4 are typically the brand name drugs. Tier 5 is usually the specialty medications. And here's the tricky part, every insurance company chooses which drugs go in which tier. That means the exact same drug can be $5 in one plan and $71 in another. This is why picking a plan based on premium alone is a mistake that costs seniors more than almost any other decision in Medicare. The premium is the tiny cost. The prescription prices are the real cost. And sadly, most people don't learn that until they've already been hit with a price they weren't expecting. Now, let's talk about the part of Part D that confuses almost everybody, the famous phases of Part D. Because this is where seniors go from calm to frustrated in about 6 seconds. You've probably heard words like deductible, initial coverage, catastrophic coverage, but nobody ever tells you what those mean in terms of how much you actually pay at the pharmacy. So let's make it simple. Every year, Part D starts you in something called the deductible phase. Not every plan has a deductible, but most of the low-premium plans do. In 2026, that deductible can be up to $615. That means you pay full price for your drugs until you've spent $615 out of your own pocket. But here's the part they don't explain: many plans waive the deductible for Tier 1 and Tier 2 generics. So your cheap medications might still be cheap, but your expensive medications could hit you with the full cost until you meet that deductible. That's why someone might suddenly see a price like $132 or $247 at the start of the year. They haven't met the deductible yet. Once you get past the deductible, you enter what's called the initial coverage phase. This is where most people spend most of the year. In this phase, you pay the copay or coinsurance listed in your plan for your drug tier. Maybe that's $2 for a Tier 1, $10 for a Tier 2, $42 for a Tier 3, and maybe a percentage, like 25%, for a specialty drug. This is where Linda, the woman I mentioned earlier, was getting caught. Because if a drug moves from one tier to another, or if your plan changes its formulary, or if the pharmacy changes the negotiated discount on a drug, your copay can jump. And when you're on a fixed income, even a $15 or $20 jump feels big. And it's not your fault. It's just the structure of the system. But everything changes when you hit the next phase. And this is where 2026 becomes a year I've been waiting for, because so many seniors have been asking for this for decades. Before 2025, Medicare had a phase called the donut hole. If you lived through it, you know how painful that phase was. Your costs suddenly jumped, sometimes doubling or tripling overnight. People would call me crying from the pharmacy parking lot because they didn't understand why a drug that used to be $47 was suddenly $143. The donut hole was a confusing mess. And finally, it's gone. But the real relief is what happens after you've spent enough money on prescriptions in a single year. That's when you reach catastrophic coverage. This is where 2026 becomes your new best friend, especially if you take expensive medications. Starting in 2026, once you have spent $2,100 out of pocket on your covered prescriptions, this includes your deductible, your copays, and your coinsurance, your cost drops to $0 for the rest of the year. Zero. No more bills. No more surprises. No more rationing medications in December because you're afraid of spending another $200 before January. Once you hit $2,100, you're done. For thousands of seniors across the country, this is life-changing. People with diabetes. People with cancer medications. People with autoimmune diseases who rely on extremely expensive drugs. People who take inhalers that used to cost nearly $300 before 2025 reforms. This cap is going to save some people $5,000, $6,000, even $7,000 a year. Now here's where the confusion comes in again. Because around August, September, October every year, people start calling me saying, "Why is my medication suddenly higher?" And they think it's because they hit the $2,100 cap. But in reality, it's usually because the pharmacy's negotiated price changed, or their plan's tier changed, or their deductible reset earlier in the year. The $2,100 cap is real, but most people don't hit it. Only people with expensive or high-volume medications do. But for those who do hit it, the cap is the biggest financial relief Medicare has created in nearly 20 years. Let me give you a real example. A gentleman named Robert from Florida takes a medication that costs almost $11,000 a year without insurance. Even with Medicare Part D, before 2025, he reached the catastrophic phase every year, and he was still paying hundreds and hundreds of dollars out of pocket. In 2026, his maximum out-of-pocket cost is $2,100. After that, his medication is free for the rest of the year. He told me, "I can finally breathe this year." That's what this change means to people. Now let's talk about something Medicare doesn't explain well: why the same drug can be different prices at different pharmacies. This is another behind-the-scenes truth about Part D that people deserve to know. Every insurance company has preferred pharmacies. These are the ones they negotiate the best prices with. If you go to a non-preferred pharmacy, your price could be double or even triple. I once had a client paying $71 at one pharmacy for a medication that cost $12 at the preferred pharmacy down the street. The drug was the same. The prescription was the same. The only difference was the contract between the pharmacy and the insurance company. This is why checking your plan's preferred pharmacies is one of the easiest ways to save money instantly without switching plans. Now, let's talk about formularies. A formulary is simply a list of the drugs your plan covers. But here's the part they don't explain: every plan has the right to change its formulary every year. That's why the drug you take today might be covered in 2024, but no longer covered in 2025. The insurance company doesn't change it to punish you. They change it because they renegotiate contracts with drug manufacturers every single year. This is why doing an annual plan review is not optional, it's essential. And it has nothing to do with being loyal to an insurance company. Plans change every year. Your needs change every year. Review your plan every year. I want to explain something that people deeply misunderstand: the difference between the plan premium and the real cost of coverage. Your premium could be $10, $15, or $40 a month. But your real cost is what you pay at the pharmacy. I've had clients choose a $7 a month plan because it was the cheapest premium, and then they paid $480 more a year at the pharmacy compared to another plan with a $20 premium. The premium is small. Your drug usage is big. This is why matching your plan to your actual list of medications is the only smart way to pick a Part D plan. Now, let's talk about the part that scares people the most: when the pharmacist says, your medication isn't covered. When this happens, it usually means one of three things: your plan's formulary doesn't include the drug, your doctor prescribed a version of the drug that isn't on the plan's list, or the pharmacy is billing the claim in a way the plan doesn't recognize. In most cases, the solution is simple: ask your doctor if there's a covered alternative or a generic equivalent. And if there's not, ask your doctor to submit what's called a prior authorization or an exception request. Sometimes the plan will approve it. Sometimes they won't. But you always have the right to ask. Now let me debunk a myth I hear all the time: if I switch plans, I might lose my doctor. Part D plans do not affect your doctors. Part D is prescription coverage only. It has nothing to do with your doctor network. That's Medicare Advantage, not Part D. So switching Part D plans only changes your drug coverage, not your medical coverage. Another important piece of truth most people never hear is that Medicare drug plans are not allowed to treat you differently based on your health, your prescription needs, or your income. That means if your medications are expensive, the insurance company cannot deny you or charge you more. Your premium is the same as everyone else's. Your coverage is the same as everyone else's. This is why reviewing your plan every year is so important. You are free to choose any plan you want without worrying about being denied. Let's talk about 2026 again, because I want you to really understand how big of a change this is. Before 2025, people could spend $3,000, $4,000, even $7,000 in a single year on prescription medications. I knew a man in Texas paying nearly $600 a month for his insulin and other medications before the new caps were introduced. He told me he stopped traveling, stopped going out to eat, stopped buying anything extra, not because he was irresponsible with money, but because he couldn't afford it anymore. In 2026, his maximum out-of-pocket cost will never exceed $2,100. No matter what medications he takes. No matter how expensive they are. No matter whether they're specialty, brand name, or generic. That's why this change matters so much. Now, I want to talk about something that frustrates seniors more than anything else: why their drug prices change month to month. Let me give you the honest truth here. There are three major reasons drug prices change. 1. The pharmacy's negotiated price changes. 2. Your plan adjusts where your medication sits in the pricing phases. Or 3. Your deductible resets in January. None of this is personal. None of this means you did anything wrong. This is just how the system works. But here's where I want you to feel encouraged. Even though the system is complicated, your job doesn't have to be. I don't want you memorizing phases or formularies or contracting rules. I want you to do one thing every single year: review your plan with someone who knows how to match your medications correctly. That's it. One simple review can save you hundreds of dollars every year and prevent the stress that comes from not knowing what you're going to pay each month. Before I end, I want to tell you one last story that shows exactly why understanding Medicare Part D is so important. A man named Thomas from Arizona reached out to me last year. He was taking a medication that cost $487 a month. He had been paying that price for 3 years. When we reviewed his plan, we discovered that a different plan covered the exact same medication for $47 a month. He had been overpaying $440 every single month for something that could have been solved with a plan review. When he found out, he didn't get angry. He just said, "I wish someone had explained this to me sooner." And that's exactly why I make these videos. Medicare isn't meant to trick you. But it is complicated. And if nobody explains how it works in a simple, human way, people end up frustrated, overwhelmed, and paying more than they should. My goal is to break that pattern. So if you're watching this and you've ever felt confused or overwhelmed by Medicare Part D, just know this: you're not alone, and it's not your fault. The system wasn't designed to be friendly. But when you understand the structure, the tiers, the phases, the formularies, the 2026 cap, you regain control. You get to make choices that actually protect your wallet and your health. So once again, comment your name and state below. I love seeing where everyone is watching from. And if you found this video helpful, share it with someone who might need it. There are millions of seniors trying to make sense of this system, and sometimes one clear explanation can change everything.